Ready?
Yeah, I'm ready.
Ready to go?
Let's launch it. Go.
Hello, good evening, everybody. Thank you for attending Health Alliance Network live and in person. I am your co-host, Steve Sellers, and my other co-host,
Steve Utley.
Steve Utley, the Steves, or we are known as Steves. Let me tell you a little bit about who we are. We, Health Alliance Network, are a health and wellness company, and we focus on online doctor appointments on demand, 24/7, 365. You have access to pediatricians, general practitioners, dermatologists, behavioral health therapists, psychologists, psychiatrists, and a prescriptions benefits plan, all wrapped up and bundled together nice and tight, available for you in all 50 states and Puerto Rico. So,
I keep getting distracted because I see people wandering around the backside of the studio over there. I don't know what they're doing.
the studio audience needs to keep it down.
That's right. Hold it down.
Keep it down,
Hold
folks.
it down. Tonight we have a very exciting show. We're going to talk about a couple of things. We have a brand new product that we're rolling out tonight for our customer base and, of course, for our agents and affiliates to promote. We're also going to talk about insurance, the whys of insurance.
The whys
of
necessary
insurance.
whys.
Yeah, so let's get started. Let's
Well,
get into it.
one thing I want to say first
Go right ahead.
is I want to reflect back on my cool little smart band. There it is.
There it is.
So with our yearly program, this comes with the yearly program. So it's made me get acutely aware of how much I am not doing. So at this late in the evening, I have about 2,500 steps I've done.
That's all you've done?
So effectively, I'm actually officially deceased at this moment. So what I try and do is get a couple extra steps in. So I'll run up and down the stairs at home. And I think my kids think Dad is a little touch of Alzheimer's at this point because I go up the stairs and come down, and they think I keep forgetting what I'm going upstairs for. So, anyway, good programs, keeps me alert as to what I'm not doing, and also drive your kids crazy.
And my wife calls it old-timers disease.
Old-timers disease.
Yeah, old-timers. That watch that he's talking about, or the fitness tracker that he's talking about, is absolutely amazing. It's free of charge with our annual program, which is already discounted 50%. For our annual membership program at the Health Alliance Network, 50% discount, and you get a free fitness tracker that tracks 14 vital functions. Check our website out. Take a look at it, healthalliancenetwork.com, giving you better access to healthcare. All right, let's get started.
Let's do it. So we're going to talk about insurance, of which we are not insurance.
We are not insurance. That's why we're going to talk about them.
We do want to talk about them.
Absolutely.
We're not going to talk bad about them. We're just going to talk about them.
I'm going to talk bad.
All right, maybe.
It's my life. It's my life's mission now.
They won't be offended.
They won't be offended. Let's talk about a couple of things. Most of us in modern society in America have some sort of insurance. A couple of insurance that probably people carry. The first choice would probably be car insurance. That's probably one of the most common.
You have to have car insurance.
Got to have car insurance. What other kind of insurance do you have? If you're a homeowner?
Homeowner's insurance.
If you're a renter?
You have renter's insurance.
If you're a human?
If you have a life.
You have life insurance. Right? Health insurance?
You have health insurance. You have disability, possibly. Disability insurance.
And what if you have a business?
And if you have a business, you have to have general liability.
The bottom line is we get insurance overload. That's what happens. It's overloaded. You need insurance for everything. But here's a unique thing about insurance. The more I'm in this business, the more I realize that insurance is designed for you not to use it. I mean, who wants to use their life insurance policy?
Yeah, not so much.
Right, exactly. Who wants to use their disability policy? And, forgive me if I have a car accident. Because here's the deal with a car accident. Let's say your deductible is $500. I don't know. It's just $500. Mine's $500 deductible. $500 deductible, and I bump into something. And I go to the body shop, and they say it's going to be about $700 to fix your car. So what do?
Well, usually you'll just work on it yourself.
I'll just bang it out with a hammer.
Yeah, that's what hillbillies do.
Hillbillies do that. I can call myself a hillbilly. I'm from Kentucky. That's right. But here's the deal. I got $700 worth of damage. I got a $500 deductible, so I'm going to come out of pocket for $200. And what happens the moment I report that to my insurance company? What's going to happen?
Rates are going to go up.
It's going to go up. So they encourage me not to use my insurance, right? The same thing with, I don't think your life insurance policy goes up if you use it, does it?
It does not. It actually expires.
It expires, right?
If you use it, it's gone.
It's gone. Health insurance, if you use it, it's called utilization. The more you use your health insurance, the more your premiums go up. If you're in a group plan, the more the group, or even one person in the group, uses their insurance, your rates go up.
Your rates go up. The company's rates go up.
Mm-hmm.
Yep.
One of the things that we are doing is that we are really disrupting this entire insurance market as it comes to healthcare. We spent a few days last week, if you watched our show, doing a symposium in Fort Lauderdale with our group of telehealth providers, telehealth payers, and
Insurance companies.
insurance companies. And one thing that we had, it was interesting because Cigna gave a presentation. Cigna themselves, who is a health insurance company, said by their own study that adding telemedicine as a standalone product by itself reduces the overall premium impact on your healthcare policy by 17%. It reduces the premiums by 17%. How amazing is that for what we do?
And that's not even having the full-on push.
No,
That's
not at all.
in their sample scenario.
Sample scenario. That's just a sample. So imagine what we can do when we enroll, say, 50 million Americans with Health Alliance Network telemedicine program. We're very excited about it. We got a couple of things we want to share with you tonight. I think that's the point. The point is, if you have health insurance, great. Look at getting a standalone plan with a company like Health Alliance Network.
You know, Cigna also said, just real quick on the outtake of that, is they had a large company who implemented it into their organization. They had a lot of employees. They saved $800,000 in that year.
That's amazing. It's amazing what we're doing, and the laws are changing so rapidly. The social acceptance of telemedicine, telehealth changes so rapidly. I don't want to spend too much time, but let's talk about how technology has changed things in the last 5 to 10 years. 10 years ago, we had a big movie rental company. You could go in and rent movies at a retail store, and the name of that, I bet you can tell me.
Blockbuster.
What happened to Blockbuster? They got busted. Right? When Netflix come on the market, Blockbuster was worth about $65 billion. Netflix come on
That's
the
a lot
market.
of video rewinds.
That's a lot of video rewinds. I'm telling you that. I think they were DVDs, weren't they? Do you rewind the DVD?
Yeah, that's hard to do.
I know it is, right? But that's why he never got them returned. He couldn't figure out how to rewind it.
Rewind these things.
Netflix come on the market, and everybody said, who's going to stream videos? Who's going to watch videos on a smart device? Or people are going to go to Blockbuster and they're going to rent videos forever.
Well, back then I couldn't do it because I had a flip phone. So I had
you
couldn't watch it very well on my flip phone.
And where's Blockbuster today? They didn't catch on.
I think there's one left, isn't there?
I don't think so. I think they're completely gone. I'm not sure.
It's in a
Let's ask our
museum. It's in a
studio
museum.
audience. Is there a
Museum
Blockbuster
somewhere.
anywhere in America?
There is one left.
There is one left?
Yeah, there is one left.
Really?
Yeah, but it's a separate. It's a special entity, I'm told.
Oh, okay. Well, I didn't know that.
Oh, you know what they do? They stream Netflix there.
Yeah,
But
Let's talk about some other disruptors in the market. So, in any event, nobody goes to a video store to rent a video. They use technology. They're so used to that. Let's talk about some other technologies that people might use today that didn't exist or existed, but it wasn't widely accepted 10 years ago. Who goes shopping to a store?
You know, exactly. Look what Amazon's done. And,
Total disruption.
Look to the announcements just a recent of a long-time 100-year-old brand that some people just love to death called Sears, where Sears and Kmart are filing for bankruptcy. Don't worry, they're going to come back, Steve.
I love Sears.
They're coming back.
I
That
still
blue light
like-
special
I like
is not
Sears.
going anywhere.
I love
Somebody
Sears.
will adopt it.
I like it.
But this is what happened. Amazon is the catalyst for all these brick and mortars going out of business. Although I have to say, Walmart has figured out a way to be competitive.
They're
and
competing.
profitable.
They are competing. The thing is, you can if you don't catch on, you're not going to be able to catch up.
Yeah.
So why shouldn't healthcare be the same way? Let's disrupt the market. Let's disrupt the market with technology. The interesting. I had 1,000 things to say, but we're going to run out of time here pretty quick. Let's see what the time looks like right now. Yeah, we're into this 9 minutes, so we've got about 6 minutes to complete the show here. So you want to talk about something that's coming up?
Yeah, we have this new program.
We do have a new program.
We have a new program that we haven't even introduced to the studio audience, so I know we're going to be excited about this.
That's right.
So in us, especially us parents who have kids getting ready to go to college, which mine are in another 10 years, although the gentleman next to us, his kids are going to college.
Yes.
We have a new program we're implementing very shortly, within minutes actually,
Yes.
which is going to provide college students and
Right.
students in general a deeply discounted benefits program, telemedicine program that they can use while they're away at college.
It's called College Kid Healthcare.
College
In
Kid
fact, you
Healthcare.
can you'll be able to see our landing page now called collegekidhealthcare.com. It's an amazing. The price point is amazing. Everybody knows what we do now. You have unlimited medical visits with a doctor 24/7. So if you're a college student and you roll in from say a football game at 11 o'clock at night to the dorm, and you're not feeling well because you were
It's a long night. You're just
it's a
busy.
long night. You're just busy. You don't
Just
feel
busy.
well.
No
You got
special
flu-like
reason.
symptoms. You call your mom and say, "Mom, I don't feel well," and she goes, "Well, go to the urgent care. Here's $150, or go to the emergency room. Here's $700. Just go see if you got anything wrong with you." Or you could, as a college student, pick up your phone, use our telemedicine program through Health Alliance Network, and just talk to a doctor on the spot right there at 11 o'clock at night, no matter where you are. Phoenix, Arizona, New York City, Dallas, Texas, Miami, Florida. It doesn't make any difference where you are.
On demand. And then
It's on demand.
if you have the right connections in the area, then you can actually get any prescriptions that might be due to you delivered.
Delivered to you. That's absolutely correct. It's a great program. College Kid Healthcare is a big part of the future of Health Alliance Network. We know that college kids, unless they're on their parents' health plan, have no health care. And even if they do have health care, let's say that your child is a resident of Florida, but they're going to college in Maine. Who's their primary care physician? Who are they going to call, even if they have health insurance? Who are they going to call at 11 o'clock on a Saturday night?
And also when a college student goes away to school, he's not calling his pediatrician.
No.
Because that's kind of when you transition off
Yeah, that's
pediatrician to a general,
Mhm.
and you want an adult doctor.
Even if you're on your parents' plan, you cannot find a doctor at 11 o'clock on a Saturday night, which is when I always got sick when I was in college, at 11 o'clock on a Saturday night. I just toughed
Why
it
is
out.
that?
I don't know. Football games.
Football games.
Football games, that's right. Every single time. Every single time. You want to know the best part of what this plan is? Everyone that's been associated with Health Alliance Network already knows that we offer this entire family plan for $35 a month with unlimited medical visits, unlimited dermatology visits, behavioral health counseling, beautiful thing, behavioral health counseling, and our free prescription benefit plan.
I do want to touch
Did you
on that.
burp
Did
or
I?
hiccup?
I was
We'll call it a
choking. I
hiccup.
was choking.
You
I
were
couldn't believe
choking.
you said all that in one breath. The behavioral health is interesting too, because given the stress you're under, especially when finals come up, the stress is tremendous.
Or you could just pay somebody to do it.
Or you can,
There's no stress then.
There's no stress. There's no grades.
Yeah, there's no grades either, right?
You get a fast trip home quick. But the behavioral health, I think, is a tremendous value added for students looking to get a couple things off their chest. The stress of school is very real.
It's very real.
And we hear about it throughout the nation. There's always stories that come back to us when we're hearing about challenges with the stress of life, and college is a big part of that in the beginning. To have that psychiatrist, psychologist, therapist available to you to make that phone call
24 hours a day.
24 hours a day is
Right.
brilliant. That's for me as a parent and our studio audience, I'm sure if such a situation was to occur, he'd be excited in the fact that my kid has on demand a therapist to have a conference call with at any time, any day, just to take your blood pressure down about 1,000 notches.
Invaluable.
Invaluable.
Can I talk about the flu?
You okay?
I'm good. Not me,
Oh,
just
okay,
in
okay.
general.
Yeah, I got kids.
Here's something that we know when you're getting the onset of the flu. If you don't deal with the flu on the onset, you're going to get a full-blown version of the flu, and you're going to be bedridden, throwing up, high fever, feeling miserable for a week. But if you deal with it right away, there's a good chance that you can get a prescription. Tamiflu is the most popular, and you can eliminate a great deal of the recovery period from the flu. Now, let me tell you why that's important. Our most recent study says that the average time to get a doctor's visit with your primary care physician in America right now, straight up visit, is 28 days. 28 days of the time I want to get an appointment with my doctor. But if you call them and say I have the flu, then you could get that reduced to about 2 days. Great. In 2 days, I'm going to have a full onset version of the flu. Now, the reason that's important,
And then also, by the way, that's squeezing into the existing schedule. So that's
Right.
not like you have a real appointment.
No,
That's
no,
just
no.
the doctor has to take you in because it's almost an emergency
it
situation.
is. It's urgent.
Just come, and whenever they free up 2 or 3 hours later, you get to see somebody.
One of the things I want to talk about, why I brought this to the attention about getting the flu and seeing a doctor, it's important you get to a doctor and get a prescription, if possible, as soon as possible. A friend of mine, I called him the other day just to check on him. I'm just saying, I had a odd feeling. I called him and said, "Hey, dude, you sound horrible. You okay?" And he goes, "I don't know." I woke up this morning, I got a fever, I'm sweating and cold sweats. I just feel lousy. And I said, "Why don't you use your telemedicine product? I know you have our telemedicine product. Why don't you call it in?" And he goes, "Yeah, I was thinking about that, but I don't know if they could diagnose the flu, and I'm pretty sure I got the flu. Just try it." The bottom line to that was he did call. He got a diagnosis, the flu. He got a prescription for Tamiflu, and the very next day, he sounded like a complete new person.
Yeah.
Now, if he hadn't done that, he'd been in bed for a week and suffering and missed work and all the other events, life events that happen. It's an amazing thing. Let's get back to our college kid healthcare. Very excited about this new program we're rolling out. It is deeply, deeply discounted because we want to serve the student population.
Yeah, I thought it was interesting when we discussed it with our focus group.
Yes.
We barely got through the description before they said, "Where do I sign up?"
Where do I sign up?
I thought that was absolutely brilliant. So, that was that one where we said, that's a good product.
That's a good product.
And it's
and
a
peace
great
of mind.
service, a great service to offer.
Peace of mind for parents. They know that their child at college has access to a medical doctor, U.S. board certified doctor, 24 hours a day, 7 days a week, no matter where they're going to college. They could be going to community college. Go out to their car, call a doctor, get a diagnosis, get a prescription. Sometimes you just want to rule things in or rule things out.
True. And also, you don't have to be, under 26 to have this program. You can be under 26, but you can be over 26. It's a matter of you're in college.
You're in college.
We have a lot of people. I mean, I have a lot of friends that are going to college in their 30s.
Yeah.
And healthcare is a challenge. It's a challenge.
It's
and
always
the way
a
healthcare is changing right now with the penalty going away next year and everything else, it's kind of up in the air as to what's going to happen with healthcare rates.
It's going to go through the roof. We already know what's going to happen. You can expect a rate increase between 10 and 13% next year on your health plan. That's the estimates. We'll see what happens. One of the things we always talk about, we don't take ourselves very seriously, but we take what we do very, very serious. Mm-hmm. We like to do little things. We focus on little things that allows others to do great things. Now, we have another little caveat to our college kid healthcare plan. It's a really neat little caveat. When you sign up for College Kids Healthcare, we have an optional program that we're going to offer to you at absolutely no charge. It's not going to be an upcharge. It doesn't cost you anything, but you have to opt into this optional program, and it's called our Student Savings Program.
Right.
Student Savings Programs offers deep discounts on over 30,000 products. 30,000 products that you, as a college student, as a parent, as anyone could use. Movie tickets. Let's just, college kids like to go to movies.
We all do.
IMAX, 50% discount. Mm-hmm. That's not bad. The last time I probably have not gone to an IMAX, I would have hit 50% discount, but not at the full price.
It's a big one in Fort Lauderdale.
There's a huge one. I love IMAX. A couple other things that we're looking at here is movies, travel, discounts on travel, discounts on pet care. We also offer discounts. 30,000 unique discounts.
I think the effort is with the folks that are signed up to us and part of our healthcare benefits program. We do get requests for what else can you do for us?
What else can you do?
And providing financial health care, if you will. This is helping your pocketbook quite a bit.
Right.
Well, it's a program that we could put out there and offer to absolutely everybody who wants to be a part of the program and pass those benefits on through.
To get the pricing and the full outline of our program, go to healthalliancenetwork.com. There will be a link there to College Kid Healthcare. Mm-hmm. Look at College Kid Healthcare. It'll be in the drop-down menu. I think it'll be added to the drop-down menu by tomorrow, maybe tonight. I'm not sure. To the drop-down menu. Go to, exactly, get started there. Done. College Kid, go to healthalliancenetwork.com. Look on the menu for College Kid Healthcare. Go to our page, read all about it. Deeply discounted healthcare service. Includes all the benefits.
To make it even easier, healthalliancenetwork.com/college. Done. Dusted.
It's
in
with.
Stone.
That's our show for tonight. Thank everyone for attending. We appreciate your comments. We anticipate We appreciate your participation in what we're doing here tonight. Share it with your friends.
That's all, folks.
That's all, folks. Share it out on Facebook. Share it out on Twitter. We have Health Alliance Network, Facebook, Team Health Alliance. We have Twitter. We have Instagram. We have YouTube. We have Pinterest. We have Pinterest even. We're up to speed here. We're almost in the college kid healthcare plan, all right?
Health we're not going into Snapchat. I think we're going to steer clear.
We can't do Snapchat? I don't even know what that is.
I don't know.
I don't even know what Snapchat is.
The kids are doing it.
Another great show. Thank you very much, Steve. Good night, everyone.
Thanks,
we'll see you
everybody, for
next.
attending.
We'll see you next week. And don't forget to attend our mastermind training for Health Alliance Network
Be
agents
kind.
and affiliates. What?
Be kind.
Be kind. Be grateful. Thank you.
Thank you.
I can't believe I forgot that. Good night,
Good
everyone.
night.